Good morning, everyone, and welcome to today's Recovery Summit presentation presented by St. Clair County Community Mental Health with support from the St. Clair County Health Department. Today's presentation is e-cigarettes, vapes, what you need to know. Before we begin, we'd like to go over some general reminders for all of our folks that have either joined us already for the Recovery Summit or that are joining us for the first time. Please use the chat feature for any questions or comments that you have for our presenters today. Our presenters will be answering questions as long as time allows during the presentation. Today's presentation offers one social work CE, one McVap credit, and one peer credit. If you're requesting professional credits, you must remain on the webinar for the entirety time of the session. If you lose connection for any reason, just please connect as soon as possible or go ahead and reconnect. At the very end today, a survey will pop up following the conclusion of the webinar. Those of you that are requesting social work CEs, a completion of the survey is necessary. Now, I'd like to go ahead and very excited to introduce today's presenters. Our Recovery Summit is supported by the St. Clair Health Department, and we have two of our partners in healthcare here today from the St. Clair County Health Department. Elise Nichols is one of our presenters. Elise is the outreach coordinator at the St. Clair County Health Department in Port Huron, Michigan. There, she works to foster partnerships with the community and help connect residents to needed resources like food, shelter, housing, and insurance. Throughout her time working in public health, she's educated the community on a variety of topics, such as infant safe sleep, teen pregnancy prevention, youth substance use, and COVID-19. Prior to her life in public health, Nichols spent extensive time working in higher education that included a 2-year term in AmeriCorps, where she served as a college advisor in rural West Michigan. Nichols holds a master's degree in public health from Grand Valley State University and a bachelor's degree in social relations and policy from Michigan State University. She's a certified health education specialist. We also have Cassidy Livingston joining us today. She's also from the health department and is a health educator. Cassidy graduated from Central Michigan University with a bachelor's degree in public health education with a minor in substance use prevention and treatment. Cassidy is currently working on her master's degree in administration through Central Michigan University. And I'm going to go ahead and put it over to Cassidy and Elise. Thank you, ladies, for joining us today. And the floor is yours.
Hi, everybody. Thanks for hopping on. We see some of the comments coming through. Again, I'm Elise, the outreach coordinator. I am a white woman with brown hair and a white shirt on today.
Hi, everyone. Good morning. Cassidy Livingston here, health educator at the health department. I'm a white woman with blonde hair wearing a tan sweater. So thank you for having us again back this year.
Yep. All right. We'll move on to the next slide.
Okay. So like Adrienne mentioned, today we're going to be talking about e-cigarettes and vaping and kind of what you need to know. We're going to share the health risks of e-cigarettes and vapes, focusing on more of the short-term health effects. We know that vapes and these products haven't been around too long to really know the long-term effects. However, we do know some of the short-term effects. And we're also going to identify resources for e-cigarette prevention and cessation. So how do we prevent, youth from starting to try these products, as well as how do we help anyone who's looking to stop their use? So before we get started, we see a couple people in the chat, a lot of people responding with their name and where they're from. But if you could just identify your role. So are you a case manager? Are you a parent? Are you a professional? Just so we can kind of gauge our audience today.
All right. Just from the comments we've already received, it looks like we have a lot of professionals on here. Professional, case manager. It looks like a lot of people from different CMHs.
Clinicians.
Yeah.
Right.
Different hospital systems. All right. So we have a diverse group of people on the call today. Great. All right. So first and foremost, what are e-cigarettes? And so e-cigarettes, also known as vapes, are electronic devices that heat a liquid and produce an aerosol or mix of small particles in the air. They come in many shapes and sizes, as you can see. There's different generations of e-cigarettes, so they're kind of listed right there in the picture. Most have a battery, a heating element, and a place to hold a liquid. Some cigarettes look like traditional cigarettes, cigars, pipes. Others can look like flash drives, even highlighters. And some kind of are like tanks and mods, which you see on the left-hand side. E-cigarettes are known by a variety of different names, and just so you know what those are, we might use those interchangeably throughout the presentation, but e-cigs, e-hookahs, mods, vape pens, vapes, tank systems, electronic nicotine delivery system, or ENDS. So a lot of people in the healthcare field might hear that and know ENDS is e-cigarettes. And of course, vaping. And just some brief history on e-cigarettes. The technology of e-cigarettes have been around since the 60s, but they haven't really been commercialized since the early 2000s. So in 2003, a pharmacist in China was one of the first people to successfully commercialize an e-cigarette. And then the first shipment of e-cigarettes to the United States, 2006. So e-cigarettes have not been around a long time, but have sure made an impact in the short time that they have been present.
I think another important thing to note too is this group of products is ever changing. And we talk about the different generations of how they've kind of evolved. We at the health department have gone out to middle schools. We've gone out to different community groups to talk about this same subject. And we really try to keep our education relevant. So one thing we've done recently is, if you've heard of the Tall Cop Says Stop, he does great presentations on where he's going out into the community. He's going to these retailers and really finding out what's being used, and he'll go in undercover and then provide really valuable education to the community. So recently we've sat in on some of those presentations. So we're excited to share with you all kind of what to look for.
Yeah, more real time, right?
Okay, so a little poll. This may seem like a silly question for some of you, but it's something that we do hear. So, fact or fiction? Vapes do not have harmful chemicals in them. It is only water vapor. So once you see the poll pop up on the screen, go ahead and take a vote.
Adrian, can you pop up that poll for us?
I sure can. It looks like the poll actually popped up, and about 3% said it was fact, and about 96% said it was fiction.
Okay. All right.
Well, that's right. So it is fiction. We know that vapes do have harmful chemicals within them, and it's not only water vapor. So we're going to get into what those chemicals and products are in those devices.
And the reason, of course, that we just see the results pop up now too. Thanks for everybody who answered. The reason we put that question in, I know it might be silly to a group a little more seasoned, but when we go out to the schools, oftentimes, I think they're getting better and better, but we've seen a disconnect of what's actually in vapes, because they can be very, very sweet smelling, they can be flavored, and they may not associate some harmful chemicals in vapes like they would maybe a traditional cigarette. Mm-hmm. So let's get into what's in a vape. So we have some volatile organic compounds, nicotine, which we know is an addictive substance, ultrafine particles that can go deep into the lungs, cancer-causing chemicals, we also call those carcinogens, heavy metals such as nickel, tin, and lead. And then again, a big difference between traditional cigarettes and vapes is a lot of the flavoring that we see, oftentimes sweet or even candy scented. And that flavoring, or a component of that flavoring, is called diacetyl, which is a chemical linked to a serious lung disease. So if you see the graphic associated with that, it's popcorn. So back in the day, in these popcorn facilities, manufacturers, they use diacetyl as a kind of component to make the popcorn, and it would get airborne in the lungs and it would cause some serious issues for the workers there. So they call it popcorn lung. And again, that's one of the same things we're seeing in vapes too, a same chemical. And just so people know, I know sometimes there's this disconnect of, well, vaping's healthier than a traditional cigarette. It is true that there are less chemicals in a vape than a traditional cigarette, but there are a lot of the same chemicals in a vape as in a traditional cigarette, like nicotine, like carcinogens, like heavy metals. So again, a lot of harmful things in vapes that also correlate with traditional cigarettes.
Okay, so how are vapes regulated? So throughout the past couple of years, we've seen some major changes, specifically in Michigan related to the regulation of tobacco and vaping products. So going back to 2016 is when the FDA really deemed to have regulatory authority to cover e-cigarettes, obviously knowing that they were kind of new in the United States. They really decided it was time to have some control over who, what, when, and where that they would be sold. And then flash forward to 2019, e-cigarette flavor ban was signed by Governor Whitmer. However, most of us probably know that that really didn't get too far. It was signed by the governor, but we still sold, retailers were selling those flavored products at their stores. One thing we're going to talk about later in the presentation is really how those flavors are targeting youth and the younger population. So in an effort to try to diminish that chance, the e-cigarette flavor ban was signed, but like I said, it didn't get too far in production. In 2020, the FDA required all vaping products to be approved for sale. So before anything was sold or located on the shelves of these stores, they had to be approved by the FDA.
They should be, right? They
should be. Right. I think the key word there is should. We know that really didn't quite start happening. And then also in 2020, which was huge, federal law increased the age to buy nicotine products from 18 to 21 years old. So you're looking at individuals who are younger, not being able to access those products anymore, being 21 to purchase any tobacco, e-cigarettes, any products like that. So that was huge for federal law, as well as we saw in Michigan. You'll hear tobacco 21, different things like that. That was a huge period for growth in this area to increase that age and really limit the amount of the population that has access to these products. Also in 2020, Michigan expanded their smoke-free laws to include e-cigarettes. I think people kind of forget about this piece where, you don't see people smoking cigarettes in restaurants, in movie theaters, different things like that anymore. Well, that also applies to e-cigarettes. So I know sometimes even around here in St. Clair County, you'll go to a restaurant, you'll still see those no smoking signs in the booths, which is interesting. However, these smoke-free laws like smoke-free campuses, smoke-free facilities also encompasses e-cigarettes. So where you should not be smoking a regular old cigarette, you should not be using an e-cigarette or a vape either. And then in 2021, the Whitmer administration withdrew the flavored nicotine vaping bans. This was not something that was followed by retailers. There are new flavors and new devices coming out faster than we can even keep track of. And it was, these are very money hungry businesses that really advertise and target towards specific populations. And it's interesting because disposable and fruit candy flavored products cannot legally be sold in the US, but we know they're everywhere, right? So we're going to talk about how these are monitored in St. Clair County, and over the number of brands are increasing exponentially. So the number of brands have increased by 46% over the last 2 years. There's now about 200 brands of e-cigarettes and vaping products. So like I mentioned, these are money hungry organizations and retailers that are targeting youth, targeting everyone, and a lot of, like Elise mentioned, kind of coming from overseas. So there's very little regulation as far as how it's imported in the United States.
And just to know, I think we talked about this in our presentation last year at the summit, but these vaping manufacturers are using the same playbook that old tobacco used. They want to hook people young so that they have lifelong users, right? They want to make it appealing and cool. So when you see the ads, it seems like people are having fun, like they're connecting with other people, seems like they're cool. So again, they're using social media. They're using that same playbook as big tobacco. I just wanted to note too, a CDC study found that 99% of e-cigarettes sold in assessed venues in the United States did have nicotine. So I know we've been seeing some things pop up that say vaping's healthy, no nicotine, no harmful chemicals, sometimes on the label. That's oftentimes not true. Again, 99% of those assessed did have some variety or some quantity of nicotine in them. Some vape liquids marketed as 0% nicotine have also been found to contain nicotine. So again, just something to consider, some of this predatory marketing as well. All right, so again, this is specific to St. Clair County. I know we have folks on here from other places too, but everybody has kind of different compliance as far as their localities. Here in St. Clair County, we have an agency called Impact that works with our Region 10 PHP and the state to conduct compliance checks. So in 2022, I guess I should step back here for a second. They do their own compliance checks, and they also have checks that they do in coordination with the state. So those are called SINAR. And then the ones they do on their own are called non-SINAR. So just some context for this slide. So in 2022, 7 out of 60 stores attempted to sell to teen decoys during the non-SINAR checks. And then in 2022, during the SINAR checks, 2 out of 10 attempted to sell. Now, for those SINAR checks, the state wants to see that at least 80% of retailers are not selling to decoys. So we did get there in 2022, but in 2023, we did not. So if we look at 10 out of 60 stores attempted to sell teen decoys, an increase. And again, during those SINAR checks, 2 out of 4 attempted to sell during those SINAR checks. So what they then do, our impact organization, they send this information to the state, and the state does a review and can reach out to the retailer. Impact also contacts law enforcement and gives that information there. So law enforcement can keep an eye on those retailers and do their own compliance checks as well. So we actually got some information from our biggest city in St. Clair County, which is Port Huron. In 2022, they did some compliance checks of their own and had the teen decoy. And they went to 36 different retailers in the city. And of those, 29 were in compliance, but 7 were willing to sell to youth. So we know that not only locally are our kids getting getting these products, but of course online too is a big one. So things to keep in mind, especially if you're a parent or professional.
And I think it's interesting to note too, after talking about the regulatory changes that have happened both federally and locally, it's interesting that it seems to be becoming a bigger issue, specifically in St. Clair County, and we're going to get into some of that data. Okay, so on this slide, this is a snippet of data from our most recent community health needs assessment. So this community health needs assessment was conducted in 2021. So this encompasses reaching out to a wide variety of the population and asking them about their risk behaviors, one of which is vaping and e-cigarette use. Important to note that this is only reported. A lot of the times when you ask someone, are you using a vaping product? They want to say no, right? Maybe they're embarrassed or something like that. So this is only reported. So we suspect that this number is very underreported and that it's larger than what we see. And what happens, we'll get into more later, but we take this data locally as a county and start to work on improving our numbers with our community health improvement plan. So kind of going back to the checks that Elise was mentioning, we know that specifically when you look at alcohol checks locally, you'll see in the news that they will publish a list of organizations and retailers that failed, right? So teens and younger folks know, okay, well, that's where I'm going to go because they're going to sell to me. That would include vapes and e-cigarettes as well. So we're talking at the county level, what can we do to highlight retailers who are following regulations and not selling to teens? So the last box that's highlighted in yellow, our rate in St. Clair County is 8.2% of adults reported using a vaping product. Like we said, we expect that number to be much, much larger, but you will notice it's an increase from 2016, which was when our previous community health and needs assessment was conducted, as well as the fact that it is a higher rate than the state and the nation. So by quite a few percentages, we know that this data isn't very as timely as we'd like either, but this is a good kind of benchmark to know where we want to go and improve our numbers. And that really starts, I think, here at the health department with prevention and education.
And just a note about the data too, because I think we had a question, I saw a question there about marijuana. It's only as good as our data, right? Because we know that in vaping products, there might be nicotine. Most of the time there's nicotine, but there also may be marijuana. So what does that data look like? So that for that previous slide, it only included nicotine and excluded marijuana use in that vaping number. It just depends on the survey and what kind of questions they ask. So it can look different from survey to survey. So the data is not as consistent as it is maybe with like traditional cigarettes yet as it is with vaping. Just a note there.
Right. So this slide here shows that underserved residents are reporting that nicotine and vaping is having a negative impact on them or their families. So number one is alcohol, but nicotine and vaping, interestingly enough, is above prescription drugs and marijuana. Like Elise mentioned, this is kind of self-perceived. So nicotine and vaping, you may classify them kind of as one category. However, it's divvied up as two here. But if you combine those, you're looking at just about the same negative effect as alcohol. So I guess for a question in the chat, what percentage of St. Clair County youth do you think use vaping products? So we'll give a few seconds and see what you guys think.
Just plug in the percentage that you think. All right, we're seeing 45%, 75%, 60%, 15%. It's across the board. It's higher than we want it to be, right? No matter what. 30%, 50%. Okay.
Okay, so let's see.
All right, so we conduct a survey in collaboration with the schools every other year, and it's called MyFi. And this is what we got from the MyFi. So for 7th grade, they reported that 8.2% of them use vapes in the last 30 days. And that jumped up to 11.6% in 9th grade. Again, that's much lower than the national average, which is reassuring, but still quite high. And then 11th grade, 20% of our youth were saying that they used a vape in the past 30 days, again, which is quite a high number, even though it's lower than our national average. 1 in 4 kids used a vape in the past 30 days who are in 11th grade. That's staggering. We've heard, I think there's going to be presentations from law enforcement and school resource officers during the summer as well. But I know that's a huge problem in our schools, and we hear that all the time at the health department about people finding vapes and people vaping in the bathroom, outside during breaks. So this is pretty staggering numbers for our county. And again, I think we have a lot of folks there too on the call who are in other counties. This MyFi data might be something you'd like to look at too for your own county to see where you're at as far as these statistics.
And I think too, just similarly to adults, we also estimate that this number is largely underreported. So it's continuing to increase. So the next round of MyFi will kind of show where we're at currently.
Yep, it's all self-reported. So we have to kind of take that with a grain of salt. This is what we have, but we know that some kids may not want to actually tell what's really going on. So this is just a snapshot in time
One, I think too, like we mentioned, we've been to the middle schools, we've been to a few middle schools within St. Clair County. We've been to different community organizations, and it's interesting to see the different perceptions of going to like a community-based organization, whereas the middle schoolers, where, they kind of want to give you a little pushback and kind of want to be that devil's advocate, where they necessarily don't have that education to back it up. So it's interesting to see in the community, now that we've been getting out more post-pandemic to really get educating again, it's interesting to see how people perceive these data points within the county.
Yeah, and so as we talked about throughout this whole presentation thus far, the flavors are really kind of at the heart of this, and something that we're concerned about, the state of Michigan's concerned about, the national government's concerned about. So in 2022, most youth reported using e-cigarettes used in like a flavor variety. So that's 85% among middle and high school students who currently use any type of flavored e-cigarette in 2022. The most commonly used flavors were fruit, candy desserts, or other sweets, mint, and then menthol was kind of rounding out that. So as we know, young people want that sweet flavor, like the candy, the fruit, and that's why we've been seeing a lot of policy and regulation trying to target the flavors, because that is what our young people kind of are hooking onto. And also something to keep in mind, it's really easy to kind of disguise your use too. If it's sweet smelling, if it smells like strawberries, it smells like bananas. People, I mean, if you're not educated and may not necessarily know, you might not even realize it's an e-cigarette because of that sweet scent versus maybe like that menthol or that nicotine scent. So kind of a lot wrapped up here in these flavors.
Okay, so getting into kind of where we're at with youth is a lot of kids and youth will say, it's just experimentation. They just want to try it. They're intrigued. They want to fit in with the group that maybe they're hanging around with. However, we know that 90% of addiction begins in adolescence. So they're a very, very vulnerable population for any substance, and substance use can really have long-term implications for the developing brain. So when you're at that age, your brain is developing, your pathways are connecting, you're getting that kind of sense of pleasure, and you're not considering the consequences and how that will really affect any long-term implications on your brain or your health. Getting more into brain development, we know the brain is kind of the last to develop, not until around your mid-20s. And problem-solving skills, time management, all those different areas are forming, they're processing, and you're at that age where it's an overactive impulse to seek pleasure. And like I mentioned, less ability to consider consequences. So these chemicals, these products that are found in these devices are going to affect your ability to do those things. Kind of think of it as the way alcohol will affect your ability to drive, to make healthy decisions. These products in these vapes, can be just as harmful as the brain is forming. So substance abuse in adolescence can cause learning difficulties and actually some long-term health problems in adulthood. Like we mentioned, we're just kind of waiting to see scientifically what those health problems may look like, because they haven't been around that long. So, think of how, tobacco, your classic cigarette used to be considered healthy, right? So it used to be everyone was smoking cigarettes, and then there was a huge wave where all this information comes out and everyone kind of stops. We don't want our youth to be those guinea pigs to find out what's going to happen to them long term. So that's something we really stress, especially when we go into the middle schools, is we don't want, your group of students to be the ones to figure out what's going to happen. We know popcorn lung can occur. We know, vapes can, because there's the battery component, which Elise is going to touch on, they can, explode and kind of different things like that. We know they're dangerous. However, we don't know too much about the long-term health effects.
Yeah, as Cassidy said, those studies are ongoing. They've only been, these e-cigarettes have only really been around and commercially successful since 2003. So it hasn't been around to cover an entire lifespan yet, like traditional cigarettes. And as we say all the time to our students that we go in and talk to, or even community members, we don't want you to be the guinea pig. We don't want to figure out the lifespan of an e-cigarette and the healthful or the harmful health effects because you're the test subject. That's not what we want. We know a lot of these same harmful chemicals in traditional cigarettes are also in vaping products. So although we can't say for sure what's going to happen, these chemicals are present in both and definitely a concern. The aerosol could also be harmful to the lungs in the long term. And then we've also seen, I'm sure you maybe have seen these in the news, defective e-cigarette batteries have caused some fires and explosions, a few of which have resulted in serious injury. So exploding when you're actually smoking it, or even in the pocket or in a backpack, we've seen as well. So some other health impacts, something that I don't think folks necessarily often think about, but children and adults have been poisoned by swallowing, breathing, and or absorbing e-cigarette liquid through their skin or eyes. So nationally, approximately 50% of calls to poison control centers for e-cigarettes are for kids 5 years of age or younger. Again, if we have these, parents, or even if you just have a babysitter or somebody around the house, if there's this perception that vapes aren't as harmful as traditional cigarettes or aren't harmful at all, and they're just left around, kids are curious, they get their hands on them, they are harmful, and they can cause serious issues, especially in young kids. So we encourage, if you do use, keep it out of sight, locked up, but also have that conversation with your kids about the harmful effects of vaping too, and have some honest conversations there, because we don't want to see any poison control calls unnecessarily because of things being left out unintentionally.
Okay, so some preventative strategies for parents. We covered this really heavily in our presentation last year during the Recovery Summit. We all know it's a little hard to talk to teens about telling them what they should and shouldn't do, right? So one thing we try to do is not, shame when we go out to these middle schoolers. We don't use a scare tactic. We just try to provide them education. And we always try to tell parents, set a good example. So be tobacco free, make sure your child is not exposed to that secondhand emission, whether it's from a traditional cigarette or the vaping aerosols, and have ongoing conversations. So things change, and as kids get older, they're asking questions, they're learning about different things. Have those conversations and make sure that your student or your child knows that if they're caught with a vaping device, or if they do that, this is what could potentially happen. Like I said, we're heavy on education, let them kind of know the harmful effects, but have the conversations and be a resource for them, because aside from their health classes in school, they may not have that opportunity to ask questions, and they may learn the hard way when they choose to partake in that activity. And then share facts and resources. So we're going to pop a link in the chat. The CDC has really great resources and fact sheets with information to share, as well as the Surgeon General. Like I mentioned, there's ongoing presentations nationally and statewide that are kind of focusing right now on how do we talk to schools about this? How do we get their buy-in when it comes to making changes, right? So there's a lot of resources out there. We know that. We just hope that they're being used. So wanted to share that with you all. And
I did pop that link in the chat. It's like it's a parent guide on how to talk to your student or your youth about vaping. And as Cassidy said, well, we see a lot of misinformation, right? Within the schools, or from student to student, or even when we go and talk to adults in like different like a homeless shelter or community group or something like that, there's maybe some misinformation spread amongst the group. So giving them the facts about what vapes actually are, and about what we know is some short-term effects, but also some of the unknown long-term effects. If they have accurate information, I think they might be able to make some better decisions rather than you don't know what you don't know, right? So giving them that information through those ongoing conversations is really important. All right, so as I said at the beginning, we have 4 generations of vape products. And so we're going to walk through what each of these look like and how they're used. So we'll start with the first generation.
Okay, so the first generation are kind of known as the disposable e-cigarettes. So these really mimic your classic cigarette, and it's designed for one-time use. So you use the product, then dispose of it. And these aren't seen, I don't think, too prominently right now, but they're not rechargeable or refillable. So they're discarded when it runs out, like I mentioned. And they're really designed to mimic and look like a classic cigarette. So sometimes you'll hear them called cigalikes, which that was a new term for me. So it's interesting. And so this would be classified as more of the first generation. So, and one thing we were talking about yesterday is the amount of times that you'll see these products disposed, like for example, on the streets or in our community. So
on the
it's
beach,
interesting.
we live right on the beach here, have a beautiful body of water. And the amount of times I see those disposable flavored vape pens on the curb, in the sand, like right next to the trash can. I think a lot of people can relate. They're everywhere, especially the disposables. All right, so this is second generation. These are pre-filled and refillable cartridges. Unlike that first generation, they are rechargeable, and you can put different substances in it. So like nicotine, cannabis, THC, CBD, flavoring, solvents, anything like that. The cartridge is attached to a battery pen, which then contains the battery. The battery and the cartridge are typically sold separately, but you can also get them in a starter pack. So I know these are kind of unique looking, different. Again, not something we see as much, but again, something to look out for, especially if you're a parent, a professional, just so you're familiar with what these look like and how they operate.
And these, I think, also mimic the pens you'll see that now marijuana is legal for specific ages and populations. These products can contain those substances. So sometimes it is not just nicotine or vape. It's marijuana, it's CBD, but at the end of the day, it's still flavored. So you'll smell kind of that your classic smell of like an e-cigarette.
It can be flavored, or it could just be that traditional menthol. So it just depends, but we know that people tend to like the flavor.
Okay, so third generation, these are referred to as kind of tanks or mods. These are also rechargeable, they're refillable, they're bigger, so they're not as easy to hide, and they're kind of modifiable, hence the name mods. So it really allows the user to kind of determine what they want to put in it, how they want it to look, different things like that. Different tanks have different coils in them. So the purpose of these, I think, is really to create that large cloud of aerosol or smoke with a stronger hit of the nicotine. So I think this really appeals to those individuals who, want to take a hit of their e-cigarette and really get that hit of nicotine. I know sometimes, like even driving down the road, you'll see a huge puff of smoke come out of a vehicle, and it's like, okay, well, they're vaping. It's a very, very large cloud of smoke that you'll see from these devices.
And something that we haven't talked about before, obviously this is a really concentrated form of nicotine, but one traditional vape has about 20 cigarettes worth of nicotine in it. So the concentration is much higher in these vape pens than in traditional cigarettes when it comes to nicotine too. So you're getting hooked quicker because you're getting these quicker hits. So something to consider too, especially something like the Mod Pod and the tanks that are a little bit bigger. Okay, so these are called pod mods. So they have a pod cartridge and they're also modifiable. So AKA pod mod. And they can come in all shapes and sizes. As you see here, we have, I think on the left-hand side, to me, it kind of looks like some funky highlighter, that blue one. In the middle, those the blue and the black are typically ones that we see a lot, those flavors. And on the even the right-hand side, the top right, it almost looks like a USB. And on the bottom, like a flip phone, potentially. This is what we've heard from people. The bottom left, maybe like a cigarette lighter or something like that. So they can look like other things. So if we see these in like a backpack or in someone's laundry or something like that, it may not be just a highlighter or just a USB. It could be a vaping device. So these are pre-filled and refillable. These are, again, the 4th generation and common brands. Juul, a lot of people remember Juul. There are so many different brands. It's even hard to, as Cassie said earlier, there's so many different brands coming on the market daily that it's hard to kind of keep up. And again, you can put nicotine, THC, CBD, a different type of liquids in here to smoke.
One thing I've noticed too, specifically around St. Clair County, is the amount of advertising and posters I see around these retailers that the more you buy, the cheaper it is. So I always see signs for the brand Breeze, you know, if you buy 3, it's $33, or it's, you know, 1 for $15. So they're marketing. So you're thinking you're getting a better deal and you're buying more.
Yeah.
So last year we presented on kind of how to talk to your teens about substance use, and kind of going off of what Elise mentioned. There are sweatshirts these days, there's water bottles, there's all these type of daily items that have been conditioned and modified to hide these products as well. So these, like we mentioned, are more smaller. They're kind of easier to hide. The bigger ones, things like that. But, you know, we know that teens and other individuals also are kind of hiding substances. So, okay, so a little scenario for the group. So say you're a parent or you're working with someone, you find a disposable vape pen in their coat pocket when you're doing laundry. What do you do and who do you turn to for help? So let's kind of see what you guys think, and then we're going to provide some resources. So go ahead and enter some of your responses in the chat.
My life, my quit. Give them information, ask child where it came from. I think I would ask them and give info, call you two, educate them. I talk to them myself and ask questions. Yeah, we did a presentation last year, was all about how to talk to your teen, what to do if you do find something. And I think a lot of you all are right on the money as far as asking them, where they got it, why they're vaping, have a discussion, have that talk.
Right. Like we kind of said earlier, they don't know what they don't know. So be that open ear for them to ask questions.
But then, you know, so you find something, right? And we know that there are high concentrations of nicotine. So I'm looking at 2 screens. There's high concentrations of nicotine in these vapes. So it may be difficult for them to stop, whether it be an adult or a young person. So here are some resources to help them quit. So there's American Lung Association for Adults, My Tobacco Quit Link, National Institute, and then SAMHSA's National Helpline. I'll just give a little plug to the Michigan Tobacco Quit Link. That is through the Michigan Department of Health and Human Services. And so they can help folks who are vaping, but also who are using traditional cigarettes quit. They can call. There's also a text and a website too option. And for those who are on Medicaid, they can also get some assistance with products. So if like they may need a patch or the gum to help them quit. I think there's even like monies for rewards or different types of rewards if they meet these goals to quit. So there's a lot of options, but I think My Tobacco Quit link might be a great place to start if you're in Michigan. And if folks do need Medicaid, because I mean, you don't need Medicaid necessarily, but there are some perks through the Quit link. If you are on Medicaid, some extras. If someone you know or yourself needs Medicaid, you're in St. Clair County, we can also help with that here at the health department. We have our outreach department who can help you sign up for Medicaid and get that healthcare you need and get connected. So for youth, My Life, My Quit, it's also through Michigan Department of Health and Human Services. And that is really centered on vaping. They've kind of reworked the website a lot to really appeal to the vaping. As we know, it's exploded. There's a text and call option, as Cassidy and I both know. A lot of young people don't really like to call anymore, so that text option is really appealing. And then This Is Quitting is through the Truth Initiative, which is a leader in the United States and really worldwide, pushing for regulation on traditional cigarettes and now vaping products, but also doing education and having programming to help people who started using these products quit.
Okay, and then locally, we do have a few resources. So like I mentioned earlier, Elisa and I have gone out to different schools, organizations. So our health education and outreach team, we love to go out, talk to people, answer questions. So that's a resource, as well as our teen health center. Our teen health centers are really prominent in the schools. So a great resource for if you have a teen health center located or nearby your school, or maybe your child's school. As far as cessation, so, quitting, also the Teen Health Center, we have St. Clair County Community Mental Health, and some local initiatives is, like I mentioned earlier, we have our Healthy St. Clair County Community Health Improvement Plan. So really what that does is that data we showed you all at the beginning, takes that data, prioritizes and creates priority issues for us to address as a community as a whole. So if you go to www.healthyscc.org, you'll see the full report of data. You'll see what we're doing and who's doing it, and you'll see the list of community partners. So we'll be presenting next week during the Recovery Summit on the substance use portion of the Community Health Improvement Plan, or you'll hear it called the CHIP. So tune in if you're interested in that or want to become involved. Also, if you go to that website, you can contact us. Like I said, it's a community initiative. However, the health department has historically kind of spearheaded the initiative, and there's different ways to become involved. One of the topics that we're actually covering is youth vaping. So there's different strategies and things we're doing, and many of you might be also working on that as well. Also, we have our substance use prevention, treatment, and recovery work group. This is a work group through the Community Services Coordinating Body of St. Clair County. So this group puts on panels, comes out with resources, different things like that, to really provide programming for those populations in need. So there's a lot of resources out there. So share them with whoever you may think needs them. And if you have any questions or are interested in having us come out to your organization, here's our contact information. And
before we do questions, I'll just say, we say this, we've been saying this throughout the whole presentation, but you don't know what you don't know. So when it comes to those local initiatives and things that are happening, I know sometimes when you're just not connected, you're not looking, you may not realize things are happening. So we do have things like the CHIP. We do have different groups trying to address these problems. It's not just going unnoticed, for sure. I think we're right on time for some questions.
So Adrian, I don't know if we can take some questions now.
Sure can. First, I wanted to say that all the resources that you both are sharing are awesome. And we have a lot of folks that are in the chat also sharing some really good information, resources, some ones that you've already covered. We had someone comment that Care of Southeastern Michigan and Fraser has a program called NOT, which is an in-person program that helps teens with the quit process. And a couple people commented that that was a really good resource too. So thank you everyone for adding resources above and beyond what Cassidy and Elise are talking about, because again, while a lot of them are St. Clair County resources, not all of them are, and sharing things that we have out about in the community beyond St. Clair County for everybody else has been real helpful. So thanks very much for that. I'm going to kind of work backwards a little bit on questions. One of the questions, this is a St. Clair County specific, is there a certain person or department that we would refer someone to if they needed help applying for Medicaid through the health department? So who would they contact at the health department? Because you mentioned the health department helps with that.
Yeah, so they can just call our general number here, 987-5300, and then ask for help with that Medicaid application, and we'll get you connected. It most likely will be Jill, who works with me in outreach.
You talked a lot about, talking to your kids or how to talk to your kids. You had that great scenario. I was looking through all the different, responses. Someone said a coworker of theirs even just would take them and break them and put them back in their bag, and not sure if that's necessarily the right way to approach it. But from your standpoint, what age is the appropriate age, or what age is really good to start talking to kids about the use of vapes?
Well, let's go back to that youth slide with the data, because we're seeing that was at 8.2% had been using in the past 30 days in 7th grade, right? And so every school system's different about when they have health class. And so I know for me, it wasn't until 10th grade in high school. And as we know, that's probably too late for a lot of folks. So the earlier, the better, even elementary school. And the key is not just having one conversation, it's having ongoing conversations. And like Cassidy said, letting that youth know expectations as a parent or professional in that person's life, but also, giving them credible resources about what vapes actually are, some of the health consequences. There are social consequences that we didn't even get into, financial consequences. So the earlier the better. Typically, I mean, we would love like an elementary school, early middle school talk, just because we've been seeing use earlier and earlier.
And I think it depends too on factors like, are their family members using it? When were they first exposed? Things like that. So they're going to become inquisitive at many different ages. So I think be prepared at all times.
Yeah, there might be
that
questions.
discussion.
Yeah. But oftentimes that might have to be a parent who initiates it, right? Oops.
No, I think you're 100% right. And, listening to you too, I help out with our youth football and cheerleague, and it kind of reminds me of the fact it's definitely, on a responsibility or up to the parents to talk to kids, but how there's a whole host of other folks. There's educators, especially coaches, mentors, faith-based leaders, so many different folks that can also provide that education and share with kids beyond maybe the scope of parents as well too. So I just was thinking how important it would be coming from coaches at a very, very young age as they're playing some youth sports and things like that as well too. So you had some really great points. We appreciate that. Some people were also asking about copies of the PowerPoint, and I shared with individuals that hopefully 3 to 5 days after, if you go on St. Clair County Community Mental Health, SCCCMH.org, where the Recovery Summit registration is, we're going to have a lot of our PowerPoints for these presentations available. Someone also commented, because of all of the great resources on the PowerPoint and the ones that are in the chat, if the participants today can get an email of the resources, and we can certainly gather those up and also provide a list of those to share on the summit web page as well too. So we can certainly get those out. We're getting a little close towards the end of time. Just wanted to wrap it up with maybe 1 or 2 more questions. One question, and I don't know if you can answer this really quickly or not, but it goes back to the very beginning of the presentation when you talked about how there was possibly a ban on the flavors of the vapes, and then that was lifted. Do you have any other information or reasoning why it was lifted? Is it because there was an ability to enforce, or do you have any other information on that?
It's hard to say. We know that Governor Whitmer had put that had signed it, right, in 2019. And then the administration kind of backed away from it in 2021. We can go back to that slide too. You know, some of these vaping companies are kind of have this, like we said, the same playbook as these traditional big tobacco companies. Again, this is me hypothesizing. There's a lot of pressure on her and administration to pull back on that. But even on the federal level, I know there was a ban on the was it the rechargeable, the ones that you don't throw away for the flavors, but the disposable was still allowable, which is really what I would like, you know, taking what you need to put the vape, but then throwing it out. So it wasn't really addressing the problem. I can't really speak to what happened there. But yeah, I wish I had more answers there for that.
That's okay. Thank you. When you were going over the 30-day use for the youth, was that specifically just asking if it was only the vapes for nicotine and not nicotine / marijuana when the kids were reporting? Someone was just wondering a little bit more about the data collection.
I believe that one was just nicotine, if I'm
And
not
it's
mistaken.
self-reported, right? So whatever they're willing to disclose is what they would report. So,
and I'll say too, if that person, we have a whole report on our website, scchealth.co, that breaks down all the information from that MiFi survey for that 2022 school year. It goes beyond just vaping, right? So it has other substances, it has sexual health, mental health on there too, so that we'll give you more detail about the survey itself.
Great. A lot of information. Cassidy and Elise, a lot of really awesome comments about just really great information, a lot of really good, you know, resources, and just a lot of thank yous in the chat for sure about all the information. I think one of the things I also appreciated is the fact that you talk about other names that the vapes can be called. So for a lot of us, especially me, that I feel like I'm kind of an old fogey at times, I'm not real up on some of the terms. So being able to let us know as professionals and adults, some of those other things to listen out for that we might not be, you know, as our ears open for, or might not, you know, commonly know things, as well as all the pictures, because I think pictures and visuals are really helpful, especially for parents or adults that are worried about what are they seeing, what are they finding, what does it look like. And another thing too is a comment about, you know, talking about the risk, not just using, but for kids around the house, those young kids swallowing, ingesting, putting it in their mouth, and thinking about how diligent we are a lot of times on not having items that kids can choke in around the house, because that's, you know, definitely alarming and dangerous. But knowing that these types of devices can be at serious risk or serious harm to those little ones too is really alarming and scary. So thank you for expanding on all of that as well too. All right, so as we go now, what we're going to do is we're going to wrap up for today's presentation. Again, thank you so much, Cassidy, and thank you so much, Elise. Again, like they had mentioned, you guys are going to be back. When are you guys presenting? When's your next? Remember offhand?
Yeah, next week, I believe on Thursday, we're going to be talking about the community health improvement plan, specifically the substance use portion of it. So a lot more data and information on what's happening locally.
Wonderful. And you know, that information too, even if you're not local, is still really good information, because even though it's a snapshot of the St. Clair County community, a lot of that information is really applicable across the board. And just being able to listen to that information might really interest other folks to reach out in their communities to see what kind of assessments or plans or things are done, you know, within their community too. So it's not necessarily only for St. Clair County folks. Strongly encourage St. Clair County folks to attend, though. The information you get about that plan, you know, a real snapshot of what's going on in our community, is just unbelievably valuable. So we're looking forward to having you back for that. So as we kind of conclude and wind up for today, we want to thank everyone for attending. As a reminder, this recovery summit is going all the way up to the end of September. We are about a quarter through our topics. I think we had 22 in total. Daily, we have speakers. Tomorrow's presentation will begin at 1 o'clock. presented by Dr. Claw from U of M. We've had him before. He's a fantastic presenter. He's going to talk on advances in diagnosing and treating chronic pain. He is going to touch, of course, on substance use. For anyone who is a social worker, that does count towards pain management or pain credits for your CEs, which is also nice. So to see more information and register for additional sessions for the Recovery Summit, please visit sccmh.org under the Events tab and the Recovery Summit. So a reminder, this is free and open to all in the community. As a reminder, anyone requesting professional credits, you will receive your certificate of accumulated credits by October 30th via email. So you'll get one sheet that marks all the credits for all of the different sessions that you've attended. And for anybody, not just folks requesting professional credits, us here at CMH, and I know Cassidy and Elise really want to hear from folks that attended today. So those survey monkeys of how everything was today really mean a lot to us, to let us know what went well, what you appreciated, other things you might have wanted to know, and any other comments or information you have for us, we would greatly appreciate it. So again, thanks a million, Cassidy. Thanks so much, Elise. Thanks for everyone attending. If you didn't, I saw someone said they didn't receive a survey after attending the session. If you didn't, that will also be posted on our website. So you can go on to the Survey Monkeys, and or generally the day after attending one of these recovery summits, you'll get a thank you for attending. And that survey link will also be attached to that thank you for attending email that you get about 1 to 2 days after. So there's a couple of different opportunities to be able to do that. So again, thanks everyone. Have a wonderful rest of the day.
Thank you.